I'm Dr. David Hawkins, author of In Sickness and Health. I'm also the director of the Marriage Recovery Center.
And I'm Dr. Tyson Hawkins, and I am a general internist practicing primary care medicine in Bellingham, Washington.
So I approached you and asked you if you had been seeing any connection between physical health and emotional distress. I'm working with people who are recovering from trauma and who are in emotionally destructive marriages, and so I began seeing physical issues in women, but I asked you, what were you seeing in your practice?
So my father and I started talking about some of the patterns we were seeing in clinical practice with our patients regarding emotional distress and physical symptoms. And it became clear that a lot of patients were suffering from physical distress and also emotional distress relating to an unhealthy marriage.
So we've known for a long time that the mind-body has a connection, but quite honestly, I mean, in the practice of clinical psychology, we don't really think of it that often. I'm focusing on people's emotional health, but now looking at this, okay, what's the impact on physical health? And I started running by you, okay, do you see fibromyalgia? Do you see chronic fatigue? Do you see headaches? Do you see anxiety? So what are the kinds of things from PTSD and chronic PTSD, this unrelenting PTSD that happens to women who are in these destructive marriages? You're finding women coming in with all kinds of physical problems.
I don't think there's any debate or question in medicine as to the adverse effects of stress on physical health. The question we really started to discuss was whether emotional stress deriving from an unhealthy marriage might be contributing to physical symptoms and leading to a higher number of patients coming in with symptoms leading to more diagnoses that may have some basis in an unhealthy marriage.
Yeah, and Tyson, I don't think any of us really want to say the words, is your marriage making you sick? I don't like asking that question, and I'm presuming that when people come in, you're not quick to ask, is your marriage making you sick? And yet that's what we're talking about.
And you're absolutely right. We are not, as primary care physicians, accustomed to asking questions about the health of our patients' home life. And while we are accustomed to asking about physical symptoms, the source of their stress is usually chalked up to simply stress and not further pursued. And so one of the things that I've been more intentional about, and that we hope people can be more intentional about, is asking more questions about their source of stress for the purpose of potentially finding a way to handle that stress in a healthier way and thereby lessen the degree of their physical symptoms.
We know that the body keeps score, and so the body literally keeps score. The body, you know this better than I do, that we carry stress in our body, and this PTSD and this complex PTSD, this unrelenting problems in a relationship, may not be any significant episode. It may be just an ongoing day in and day out stress factor that takes its toll on the body. And then you and I have, and Joshua, we've been talking about this, and it's just been very, very exciting to put the pieces together and offer this comprehensive way of looking at relationships in the body. We believe that we've got a very unique approach to this problem. Again, nothing new about psychosomatic medicine or psychosomatic psychology, but we're looking at stress and the impact on the body, and we invite you to pick up our book, In Sickness and in Health. We think you're going to find it very, very informative, and most important, it's going to offer you hope and a path for healing and recovery.